All right, you're live.
Okay. Let's go ahead and call the meeting to order. We have a quorum here. First item is approval of the agenda. And I think, Dean, did you have a suggestion for an addition on the agenda?
Yeah, Sarah Anderson. Is Sarah going to be there?
She's here.
She's here. Okay, gotcha. That was it.
Okay, and if Dr. Heim is able to join us, I think we would like to add an opportunity for her to just give an informal update of everything that's going on at McFarland related to COVID-19.
Right.
Okay, if she's able to join us, then we'll make that request just for an informal update. Okay, I guess first things first, let's just go ahead and use a standard that everybody, if they can mute when they're not talking, just to reduce the background noise and keep things moving that way. But first then with those suggestions, I need a approval of the agenda.
So move.
Anybody second?
I'll second that. This is Julie.
Okay, all right. What are I'm losing my train of thought. All in favor?
Aye.
Aye.
Okay, agenda approved. Let's move on to minutes. I read through, I didn't see any additions or changes. Anybody else have any feedback on the March 2020 minutes? Otherwise, if we want to get a motion to approve.
I'll make a motion to approve the minutes from the March meeting.
And I'll second that motion.
All right, all in favor?
Aye.
Aye.
Okay, motion carries. Let's go ahead and set the date for our next meeting. Which are we looking at?
So it'd be in July.
July?
So it'd be probably like the 9th, the Thursdays are the 9th, 16th, 23rd, or 30th.
Well, I would say at this point, it doesn't look likely that there would be county fairs, but just in case, why don't we stay earlier in the month to be safe? I guess I'd recommend the 9th, if anybody else has feedback.
That's okay with me.
That's fine with me too for July 9th.
Okay. So let's go ahead and set, is that okay, Carrie and Sarah?
Fine with me.
It'll work.
All right, we got that set. Move into new opportunities. Paula, Christy, if you guys want to take over.
Christy, we can't hear you.
How about now?
Yes.
I think I'd learned this by now. I know how to Zoom. It's good to see everyone. Just wanted to give you some super brief updates. We are continuing to do a lot of work under the Integrated Provider Network project. We are in the process of completing the community readiness surveys under our priority areas of adult binge drinking, prescription misuse among 65 and up, youth marijuana use, youth tobacco use, and problem gambling. So once we get that data together, it will be part of a larger needs assessment that we'll get that shared with you, but that is well underway. We're able to do those all by phone. It's actually the preferred method. And for tobacco, they did release the competitive RFP this year that was rescinded, and we have an extension on our current contract. So that will be nice, and we will be writing next year. Our mentoring programming is still going well. We're getting the ability to be very creative in how we're having our matches meet and doing some virtual group activities. And the last piece, just if you have any thoughts or feedback, our county prevention grants, we typically include some mentoring, and we had been doing parenting classes. The parenting class that we use, Love and Logic, they are not allowing us to provide the sessions virtually, which is a bummer. So we're trying to think of ways, and our concern is if we can't hold an in-person class, or if there's, depending on how things move forward, changing our work plan to use some social media outreach, addressing parenting topics with that outcome related to reach with the social media, and then include the parenting program as something that we would offer if we are able to. Does that sound like something that you would support or be okay with as we develop that work plan for Carroll County?
What is the reasoning behind not being able to do the virtual sessions? Is it a HIPAA, not a HIPAA compliant network, or?
No, we called them, and the developer said it had to do with their copyright and that they are offering the classes online.
And the terms of the grant aren't extended, right? So you have to get some of the information out within a short time period regardless. Is that correct?
Well, this would be for our coming year's grant. We did get one class in this year. We're just trying to, we don't want to have an outcome in there that we might not be able to meet. So we would still look at the opportunity to offer. We would just link our outcome to how many social media posts and reach we would have in regard to some parenting information.
I think that sounds good. It's easy to measure too,
Mm-hmm.
show proof of.
If there's other ideas or concerns, otherwise that was kind of our thought. That grant is I'm in the process of getting that written and hope to have that sent off tomorrow to the Board of Supervisors to be on the next agenda. I work with Joanne Martin to get that in, and that is due the end of the month. So that's in progress. And if there aren't other ideas or suggestions, that's all I have for you today. Thank you.
Yep, thanks. Paula, turn it over to you.
Oh, we can't hear you.
Unmute, Paula. Your microphone isn't picking up.
Nope.
Nope. Can read your lips.
You might have to call in. I think there's a phone number in the link, the meeting link.
There is.
So you might have to use that, Paula, to call in since we're not picking up your audio.
She can also leave the meeting and come back in.
Are you attempting to call Paula? Paula, should we come back to you, or are you attempting to call? You're out? Okay, we'll, how about we try to, if you want to look at, you could always log out and then just log back in through your phone with no video. And then when you get in, maybe we'll go ahead and go to Carrie with environmental health, and then we can come back to you. Okay, so let's just keep moving along. And Carrie, do you want to take over?
Yep, okay, so I sent you the monthly report from March and April. You should have gotten that earlier this week. I also sent claim from May. I just got April's this morning, so I sent that to you also. So if you have your computer in front of you, you may have April and May in front of you. If not, then I understand if we can only maybe approve May and then approve April next time, but there's not much on here. Do you have those in front of you or not? Thumbs up. Dean does, Becky does.
I have May. I don't have the other month.
We don't have April. I just sent April this morning,
Okay,
like maybe 20 minutes ago.
okay.
Do you have the monthly report?
Yes.
Does anybody have any questions about the monthly report?
With the stylist complaint, did that person lose their license, or what's the fallout from that?
We didn't specifically hear that it was factual. We just got called saying that somebody was doing it, and the local police officers had also gotten that same call, and they were going to check it out, but we never heard back from them whether or not it was the case or actually happening, or if it was just they had to catch him in the act, I guess. And I never got word that they did that. So, but we do know that there's people apparently cutting hair in their home, and police were notified to check it out. I'm not sure how much enforcement we would have to deal with that anyway.
That's what I've wondered about. I know different people obviously have their opinions, and I just keep trying to say that these are regulations that are in the interest of public health. It's no different from a law that requires you to wear a seatbelt. There's research behind it on how it's in the best interest of public health. So I just didn't know if locally, if there was any additional deterrent or enforcement on that.
It would probably be law enforcement. Beauty salons and barbers are licensed by the state, not by the county. And we really have no inspection over those facilities anyway, unless they have a tanning bed. And the tanning bed part is the only part we have any enforcement authority over. So, we get complaints, and a lot of times there's not a whole lot we can do. Just this month, I got a call from somebody in Crawford County who was concerned about cleanliness at laundromats. I don't have any authority over laundromats. So I listened to them. I listened to hear what their complaints were. I put in a call to the laundromat of the owner of the laundromat, just to be that middle person to let them know that, people are concerned about certain things. But ultimately, I have no enforcement authority over laundromats either. So I'm happy to help if I think I can, but I have no enforcement authority to force anybody to do anything differently.
Well, it appears to me that we're basically all on our own anyway, and we have to do what we think is right. We have to use common sense. If a barber or a stylist is doing business, and it's obviously a moot point now because she's opened those up, but if if somebody, say in the near future would test positive and the tracing and tracking can go back to that stylist, I would think that that stylist could lose her license and certification for violating that proclamation. So, I mean, that's, I guess I would think is the only recourse.
But people can know if they have a complaint about something, we're willing to do what we can to help or put them in touch with the right place. We do that a lot. So anyway, is there any other questions about the monthly report?
No, so how are we going to handle that, Becky? Should the board just approve the expenditure or the monthly report?
Yeah, we should still be able to conduct, I mean, we have a quorum, and we've got Art has joined us too, so we've got more than a quorum. So, all we have to do is just the same as before with the.
Right, but we just won't be able to sign.
Yeah.
I don't think you approve my monthly reports. You just approve the claims.
Right, I mean, that's what I was talking about, I guess.
So
Yeah.
Julie, did you find April or not?
I found both of them.
Okay. Dr. Behrens, did you have April and May claims from me?
I haven't looked at them yet.
Okay,
So,
they're not very long. If
they've
you want,
always been right in the past, so I'm probably fine with them.
if you want to wait, that's fine too.
No, I'll say, yes, I'll vote yes.
Well, just to go back just for a minute, I believe, and I don't know, Heather, if you want to jump on, if I'm misspeaking here, but when it goes to an electronic meeting, I think just the recording of the approval, isn't there a little note that can get put onto the bottom of the sheets that approval, overrides the in-person signature, or is there anything separate that we need to do, Heather?
Hey, everybody. I think you can just go ahead and vote normally, just like you would at any other meeting. And then if there's a signature required, you could just, maybe Carrie could mail that to you or something.
Or we could print it and mail it.
Can I
Back.
just wait until we get together again and have you sign it then?
And we can do that too. I mean, that's what the county's doing with resolutions that need to be signed, is when you get into the courthouse at some point in time, you can sign those resolutions. So
I think that sounds like the best plan, that anything that needs to be signed, Carrie, just hold on to that, we'll make our oral approvals. And then when we're able to get in, we'll just have that, Megan, to be noted in the minutes that as soon as, we're able to, and then we'll just try to set a date by which people should stop by the courthouse and sign that. Because I think they'll have to be signed before next fiscal year, right? And our next meeting will be next fiscal year.
Well, these papers, I think they go up to the auditor. So unless they're being audited by the state, those would be probably the only people that would need to see the signature. I could make a note on here saying, these were approved by Zoom meeting during COVID-19 and put the date on there. Maybe a copy of the meeting minutes attached to it, if they have to have it prior to everybody getting it signed.
Okay, so it sounds like we have a plan of action there. So I'll go ahead then, and Art, you wanted to make the motion to approve the claims? And if anybody wants to second?
That'd be fine, yes.
I'll go ahead and,
I'll go ahead and approve the claims for April and May.
okay, so we'll have that as a second. And then all in favor of approving the April and May claims, say aye.
Aye.
Okay.
So the last thing I have is our percolation test person did resign. With COVID-19, it's been, I haven't done a whole lot of advertising or reaching out to anybody. I've kind of put the word out verbally that the position is open, and people have said, hey, I know somebody who might want to do that. So I've talked to a couple people about it. No decision has been made. I do have a contract that if we want to make any changes to it, now would be the time to make those changes. If you want to be a part of that, I can send you the contract. I did not do that. But I can send what I have right now for a contract out. What we've been doing, because the installers are still installing, we have been using an online soil survey to get an aerial map of the site, and we can get from the USDA the soil types in those areas that tell us, whether it's silty clay loam or whether it's silt loam or whether it's clay or what the soil is there, and whether or not we might have potential high water table issue or flooding issue. So that's what I've been using. It's been working fairly well. We've probably only done maybe 6 systems that have gone in, but we've done it that way. And we're still going out and doing those inspections. So we're still seeing them. I still think we need to have the perk test as an option. I just wasn't sure how difficult it would be to find somebody, especially now. So that's how we've been handling it up to this point. Like I said, I've talked to a couple people. I've got one that seems fairly interested. I'm going to send him a copy of the contract for his review, and he'll ultimately let me know. So I guess I'm not in a huge hurry to fill that position, because what we've been doing is been working okay for now. So like I said, if there's any changes to the contract that we want to make, now would be the time to do it.
And I think we looked over that contract when we looked at the rate revision a year ago or so, didn't we? I believe we kind of reviewed that.
Yeah.
So I wouldn't see any, in my opinion, nothing's changed dramatically in the last year. So I wouldn't see a need to re-review it if anybody else does.
Okay.
I'm okay with it as it is.
Okay.
Yeah, and again, just like with all specialty type positions, it's just going to be, who and you're passing the word along to interested parties is probably going to go farther than any sort of big advertising or anything like that. So it sounds like you've got a good plan.
Well, it's a difficult position to fill because it's not full-time. It's maybe not even part-time. It's still a physical job, but busier in the fall than probably in the spring and in the summer. So, one of the people I talked to, they said, well, we do crop adjusting or insurance, and we're busy in the fall. I'm like, well, that's when we're busiest too, because everybody waits till the last minute to put septics in. And so that person said, well, it probably won't work for me. So I don't know how you even advertise for it, honestly. So it's kind of word of mouth. Who do you know? And I've gotten a couple of names based off that. Contractors are aware that we're not doing perk tests right now, so they know people. So I think it's only a matter of time before we find somebody to do it. But like I said, I guess right now with all this, we can't get together. I can't show them how to do it anyway. I'm not in a hurry necessarily to fill it.
Okay. Anything else, Carrie?
No, just let you know that we are continuing to do septic inspections. Sherry is still going out and doing well testing and well pluggings. We figure those are outside. We're not going into anybody's home for any reason. So we are still going out and doing our inspection work.
All right, sounds good. Anybody else have any questions for Carrie?
Well, I'm really surprised that your passports are up. Is that dropped off in the last, just recently, or were these from January, February, and then they dropped off, or?
Yeah, we've done one passport since the courthouse closed. And we did that through the auditor's office window. So I have one other person that I'm gonna line up probably to do it that way until the courthouse is closed. But as a lot of the courthouses are not doing passports right now. And the US Department of State is not doing passports right now. So even if we were full board doing passport applications, the US Department of State is saying, unless it's an emergency situation, we're gonna take our time even completing the passport process. So we cannot tell anybody how long it'll take to get a passport back, because we've gotten no guidance from the US Department of State for a couple of months, other than to say they're no longer allowing expedited service of passport. And the only way you're going to get one is if there's an emergency, and they have to go directly through them to get it. They cannot go through us. So I don't know what to tell people, you know, when they say they're going to try and go somewhere in June and they need a passport, because chances are they're, even if I get it sent in, they're not going to get it back in time.
Okay. Well, why don't we go back to Paula, if you want to give us your update.
Hello, can you hear me?
Yes.
Yes.
I've been on multiple Zoom meetings every day and not had my mic not work, so I don't know why today it's being temperamental, but I could not get it to work. So I just wanted to provide a couple updates so you guys were aware. First of all, with WIC, so for our WIC delivery services, we're continuing to provide our services basically through either telehealth or by phone with all of our WIC participants. The state waiver that is in place to waive the physical presence at clinic is good through May 31st. And I know at the federal level, they are working on expand or extend that exception to policy and allow us to continue to provide some telehealth into the future, but we just haven't heard any updates yet on if that'll be extended or if we will be starting to do clinics June 1st. Most of my staff is working from home. It's actually worked really slick with our WIC participants to do it by the phone. They've been very appreciative that we're offering that. And then we also are able to, just have our maternal health social worker give those moms a call too, just trying to meet all the needs of the families with what they're struggling with right now. A lot of them, are doing homework at home. They've got kids at home they're not used to. They're feeding a lot more mouths than they're used to. So there has been an increase in their food stamp dollars if they're receiving that, and then with their added WIC benefits, but we still get a lot of need for additional food for the housing, so we are working closely with the food pantries just to make sure we know if they're able to. Some of them have different days that they pick up and how they're handling that, so just knowing what our food pantries are doing. So like I said, at this point, we're hoping we won't be back up necessarily doing clinic June 1st. There'd just be a lot of things we'd have to get in place as far as having enough PPE for not only our staff, but if we had to provide masks for our clients coming in and just how we would space that. And since we are traveling, just how we would get our staff to clinic if we were still going to ensure that 6-foot social distancing. So any questions about WIC or how we've actually, our April numbers were up by 45, so we are definitely seeing an increase in our WIC numbers. We have gone all the way back through like our October schedule to ensure that people that have dropped off, that we've contacted them to make sure if their income's changed and they could get back on WIC. We are getting a weekly newly eligible Medicaid list from the state, and we are contacting those families. And then I've just been busy doing a lot of outreach efforts. I did reach out to all the schools through an email about just a little COVID-19 postcard about WIC's here to help. I've had it on some of the local TV channels that I could get in contact with. And then I just did a bunch of postcards, hung them up at all the grocery stores, the Dollar Generals in all of our 6-county, just by the formula and diapers, so that people knew that if they needed help with some expenses, WIC was there to help. So, any questions about WIC? I just wanted to update a little bit for family planning, our Title X clinic. That is also considered an essential service, so we are actually continuing to do our Title X clinic. And so we've been doing a lot of walk-in for that. We have had a couple of teens that are interested in getting on a method because they've been kind of bored, so they're busy doing other things. Had a little bit increase in requests for STD testing, so we've been doing a lot of that. We did, many of you maybe know our provider is Anissa Erlmeyer, and her husband is currently on the transplant list, so we did have to just come up with some plans to have some extra protection for her, and thanks to Sarah, she was able to get us some face shields and also some gowns, and so that's been working great. We just wanted to make sure we had her protected, because otherwise her family's mostly been in quarantine just to protect Bruce so that he is ready for his transplant when that becomes available. So we've kind of been busy with our Title X clinic. And then the last thing, Becky, I should have figured out, you didn't hear me earlier, but I didn't know if we wanted to put on the agenda since you signed the lead grant. Becky did sign the lead grant for the 3-county project area, which is Audubon, Carroll, Guthrie, and the dollar amount was $6,100.
Yeah, I think we have to formally approve that or note it in the minutes.
Yep, I think so too. That's all I got.
Good. All right. So have you guys been able to get any additional funding streams to help with those essential services?
We haven't had actually any additional funds come through. I do anticipate that the feds did up the dollar amount for WIC for the food dollars, just because obviously groceries have skyrocketed. I don't know if everybody saw the news yesterday. I had all the percentages. I know eggs was 16.1% increase. But so, food dollars are going to be huge for WIC. I do anticipate them probably at some point doing additional funding for WIC, just because I know Iowa's caseload grew by about 3,000 just in the month of April. So I think we'll see that only get worse rather than better for sure the foreseeable months. So.
Okay. All right. Anybody else have any questions for Paula? Okay. Don't think there's any. Does someone want to make a formal motion to approve the lead grant submission?
I'll make a motion. This is Julie, to approve that grant to add to their list.
And I'll second that.
Okay. All in favor, say aye.
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 All right. Okay. Thanks, Paula. Let's go ahead and move on. Megan, home care aides.
Okay, so I sent out my February, March, and April claims and reports. Becky, did you say March cutoff? Is that right? Okay, so I can either resend them. We'll just have to do those next time then, or how do you want to do
If
that?
you could just read them off, Megan, we could just print them on what we have, don't you think?
Yeah, because we see the categories, it's just the numbers. So maybe that would be a way, then we could go ahead and approve that yet today or reject it. So.
Okay, so you want me to just go down the line and write the numbers?
Yeah.
Okay, so 482, 133.77, 180, 81.50, 59, 397, 80, 35, and 15.
Bingo.
And then the total, Megan?
Oh, sorry, 1,463.27.
I'll make a motion, Dean Shetler, to approve those claims.
And I'll second those claims from March, April, and May.
Correct.
Okay. All in favor? Aye.
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 Okay. All right, those have been approved. Can you keep going, Megan?
Let's see, what else did I, were there any questions on the reports by chance? Nothing really stuck out to me, I guess.
No, it looks like you're pretty well on target for the year, as far as your budget is concerned.
Yeah, I didn't see anything that jumped out either.
Okay. And then the last thing I had was the United Way donation. So I heard from them, and for the year we were awarded $500. So I will just need a motion and second to approve that donation.
So where does that stand? Is that up from last year?
That's the same.
Same? All right, I'll make a motion to approve that.
I'll second that.
Okay, got a motion and a second. All in favor of accepting that donation, say aye. Aye.
Aye.
Aye.
All right, motion carries.
That is all I have.
All right, I've got a million documents up here, so I've got to, okay, get back to the agenda. All right, should we move into public health nursing then? Sarah?
Everybody hear me okay? All right. Well, let's go through, did you guys get the stats and financial records I sent? Okay. So as you see in the bioterrorism, so our bio EP, those numbers have gone up a lot in April, mainly the hours worked in those just because of COVID. We're spending a lot of time investigating, tracing, working on PPE, going to webinars. There's just a lot more work now going into that category. We're not going out doing foot clinics, blood pressure clinics, any of that, just because social distancing and stopping or slowing the spread. So you see in April, we did not have any participants for blood pressure clinics, Care for Yourself program. Those are all kind of on hold. Our immunization clinics, we are still doing them just here at Public Health, and it's by appointment only. So we're having people call in, they schedule, they come in, we sanitize when they're done. And we have about 10, 15 minutes between each person. So we make sure that everything is sanitized and dried by the time the next one comes. I guess looking at the financial part of it, Heather, if you want to jump in, I don't know if you actually got these, probably not. I think I didn't send them to you. But anyways, I know we're pretty much running low on most of our grant money through here. Just because we've been needing to spend more time doing all the PPE and contact tracing through the bioterrorism. So, you know, just looking at those numbers, they're kind of pretty much depleted at this point. We did get an extra $11,000 from our, I believe it's the 6-year FEP grant, which that's going to help purchase more PPE. So that's kind of, does anybody have questions with the stats or finances or anything like that through public health?
Is there any talk at all about allocating a little more money to the Preparedness Coalitions and the bioterrorism grant?
Not that I have heard. I mean, but then again, it was a surprise that we got that extra 11,000 to kind of help with PPE purchasing, and we do need to spend that. It's within the next year, so I'm hoping the cost of some of this PPE will go down some, so we can start. I know we would like to stock more of the disposable gowns. We should get more thermometers here at public health, because I had a lot of businesses call me asking, because right at the beginning, most all thermometers were sold out, and I unfortunately didn't have anything to loan them. So I think that's something we need to look into, of what's a need for the community, such as if something like this were to happen again, we would be better prepared. I know a lot of people have thermometers now in their businesses because of this, but you never know.
Sarah, they just released more money to emergency management grants. So we should probably have a coalition meeting, because you are able to spend some of that $11,000 on time, planning time. So if we can
Response time.
Okay, that 11,000 is response, Carrie just said.
And that was the response and planning, right, Carrie?
Well, the original grant that we started last year before all of this, we basically used up. But that time I was talking to the fiscal agent of our service area, who said that we cannot use that original preparedness grant for response time. We can use it for planning time, but not response time. So they were given this additional 11,000 something that they can use towards response. So no response claims can be used towards the original grant. But because there's been a lot of planning too, and how do you define planning? Our webinars planning, or meeting with the local coalition planning, we counted that as planning. And you can use that funds for thermometers and PPE, because that's planning also. But we didn't have that much money to start with before this all started. So it's pretty much been depleted. So the additional money of the $11,000 is the only money that we are aware of right now that you still can use for response time and additional PPE purchases.
Okay, that's what I thought.
If we meet, because they just opened up the supplemental emergency management funding on Tuesday. So if we kind of come up with a plan, Sarah, maybe we can divert some of the PPE funding towards me, and we'll run that through emergency management for community planning. Carrie and I just got 1,000 gowns in, plus 200 homemade ones. So we were going to just evenly divide that between the long-term cares. We're still going to focus on the long-term cares, especially after the governor's conference today. But then we're going to reserve some back in case somebody would have a specific outbreak, and then we'll be able to push more of that way. So getting 1,200 new gowns in, I feel much better about that going into these numbers going up. So.
Right. Well, and then Sarah, you had sent out the PPE delivery from the nursing homes from FEMA. which those were supposed to start, those boxes were supposed to be delivered starting this week, correct? I mean, according to this email.
Yep,
It looks like it. And then there'll be another delivery in June for nursing homes.
yep.
Okay, because currently right now, looking at the RMCC data for nursing homes, everybody in the county, in our county, they're sitting pretty good with PPE, except Thomas Rest Haven. It looks like they're still working on trying to get more. I think they're just trying to get enough supply for 7 days on hand.
Yeah.
And the FEMA delivery will help them this week. I'm not sure if they've received that delivery yet, but they should be getting it.
Yeah, I'm just saying, I think if you and I talk with Carrie, we can come up with a plan so that you can use more of that 11,000 towards response, and then we'll throw the PPE under the emergency management grant. That they did supplement that this week.
Okay. Okay. Does anybody have questions on that? No. All right. So the next thing, we'll just kind of do my quick little update on COVID. I know Dr. Heim, I think she joined also on this call now. So basically our county is now up to 8. We are working on contacting the patient, and then I do contact tracing. So basically what I do is I call the patient, I ask them the day their symptoms started. Then what I do is I ask them to think back 2 days and figure out from 2 days before their symptoms started until the day I'm calling them, who they were all in contact with. They then give me those names and hopefully a phone number. I then contact all those people. One case I have 25 people to contact. Another case I had 10 people to contact. So contact tracing takes a little bit. I also know that I've talked to Crawford and Audubon County Public Health. They have been so overwhelmed by all this, their cases and the contact tracing they've had to do. They've actually turned everything over to the state to do the tracing. I don't want to do that because, because once you turn it over to the state, you don't know anything. The alert that you have a case, you don't even get that anymore. That will go straight to Iowa Department of Public Health, who then they start the contact tracing and then investigations. I feel we would be completely in the dark if we turn that over to the state. So unless our numbers got absolutely crazy, I feel we're going to keep that here at the local public health. So I don't know, people just really still, I know things are opening up and I know people are itching to get out. We still just have to be very mindful that we need to social distance. We need to wear masks. You know, really watch yourself in public. When you're out in public, expect everybody around you to be positive of COVID. You need to just go about your day thinking, well, that person I was just in contact had COVID, and you just have to stay away from people. Try not to go out in groups, and that's my big thing, I guess. We still need to continue to social distance.
Sarah, so the city and the county are giving guidance because any business, city, county, school, everybody's wanting to go on vacation. Mm-hmm. What is the guidelines and the timeline? So you just said with the symptoms, it is the day of the symptoms and then 2 days prior. So if both of them are pondering policies that state if you visit a county with 250 cases or more, you would then have to come back and mask up for 2 weeks. Are they saying 2 weeks? Are they saying 7 days? Or are they saying 10 days? What is
so for the direct exposure person?
Well,
the one that's
anywhere. You go on vacation and you go to Florida.
Actually, they have lifted, the state has actually lifted that guidance where it says if you traveled outside of the county or your state, when you come back, you have to be, you should isolate for 14 days. Because it's community spread, state spread, they have gone ahead and said, well, you went traveling, when you come back, you just go about your day. The only time that you're going to do the 14-day isolation is if you travel outside of the United States now. So anytime you travel.
Not even the isolation, it's just coming back to work?
No, they don't have to mask or anything. If you come back from going to Florida and you come back to Iowa, you don't have to mask. Apparently they're not worried about it.
So, I mean, is that local guidance?
That's Iowa Department of Public Health.
Yeah, and even Heather Bombi or Michelle Heim, jump in here.
I can find, let me find the actual verbiage.
And the county's wanting to put that in as guidance. If the state isn't saying that, should we be putting that in as that they should mask for 7 to 14 days?
So if Sarah Sculte wants to send out to all of you the new guidance, she can send that out.
I can do that because I have it right here in front of me.
So I think one of the things about the masking, I think it depends, first of all, where you're working and where you're in the type of you're coming around. Our policy currently at McFarland is if you travel, you have 14 days of wearing a mask regardless. Now, granted, we're all wearing masks anyway, but that was our policy even before the state enacted some of their guidelines. And that's primarily just because you may be asymptomatic and you might be bringing something back. I think the thing about masking that people forget and continue to forget is that the mask is not intended to prevent you from getting COVID. It's to prevent you from giving it to someone else. So that's the whole purpose of the mask. So I think moving forward, all the guidelines that in every business needs to look at, if you're sick, you stay home, not, oh, well, you're not that sick, you can come in. I mean, and we should have been doing this long before COVID. I mean, influenza is a primary example. I mean, people go to work for 3-4 days with influenza, and then they finally are like, well, I should probably go get checked. I mean, there's this huge motivation to go to work, but I think it should always be, if you're sick, stay home, and you need to stay home for this long. If you were potentially exposed, I think employers have the right to say, you left Carol, you need to wear a mask for 14 days. But I think that really depends on what you do and how much you interact. I mean, I see a lot of people that are like, well, do I really need a mask? I don't see anybody during the day. It's just me and my tractor. And that person doesn't need to be in a mask all the time. But if they work with people in the public, they absolutely need to be doing something to prevent themselves from spreading it to other people. But it's definitely business to business on their decision. But I know for us at our clinic, that's what we decided is if you leave, if you've even been out of the state at all, you're in a mask for 14 days. But again, we all wear masks anyway.
I would agree with you.
I guess as far as the county and Sarah, you were in on this discussion yesterday, was the 14 days masking, and and primarily our treasurer's office has the most staff. One of the comments that she made, which probably I think is pretty sound advice, is that if our people come back from vacation or from a travel, that they don't want to be the one to bring COVID back to the county or back to the Carroll County Courthouse. And so I think there's a little bit of trust there, and a little bit of that we have to acknowledge that they don't want this to happen. So whether or not they go someplace and they're very careful, and I guess I looked at this Dr. Farr, who traveled to New Orleans, and he was the only thing that he had exposed was his eyes. And he's in the hospital right now, and he thought he should have been intubated, but he declined the intubation. So, I mean, he got really, really sick, 42-year-old guy. So it can really happen. And I don't really know what the answer is. Sure would like some guidance.
I will say the one thing to think about though is is when you have community spread, you're just as likely to get it going to the grocery store as you are to go to Florida. So I think that's the big picture. That's the difference, that once you get community spread, it's out there, and you're no more safe than if you went somewhere in town without a mask. I think that's the thing you have to realize, is that once it's all over the place, no place is safe. Everybody's an equal opportunity infection waiting to happen.
So a question that I have for you, Sarah Schulte, is from the cases that we have, do you get any indication that, I mean, you said you contacted 25 people in one of them and 10 in the other. Do you have any indication from those meetings and those contacts that we could probably have some problems coming down the road?
Absolutely. When you have that many people that you're calling to ask them to isolate for 14 days, they're all asymptomatic. They feel great. And then on day 7, they're going to think, oh, I'm going to go to the grocery store real quick. And they don't have a mask on. And all of a sudden they go home that night. I don't feel well. Well, just think of all those people they disinfected at the grocery store, not even knowing it. It goes back to, like Dr. Heim said, with them, if we're asking them to isolate, I can't make them isolate for 14 days, but I'm hoping if they do choose to go out, that they wear the mask to stop what they might have given it to somebody else. So yeah, we could potentially be up a creek without a paddle, so to speak. So with all those people that we're watching, and pretty much when I make the initial contact to the contact tracing to the people that the direct contact was in, I only make one call to them, telling them they've been exposed, they need to be isolated for 14 days. If they're an essential worker, they go straight to work, straight home. They have to wear a mask everywhere, to work, at work, and on the way home, and at home. Well, not at home, but when they get home, they take it off. If they don't do that, right? I mean, 35 people can get infected in just the 2 cases that I've been calling so far. Then I've had what I would say multiple people that could definitely be infected. And then if those 35, I got to call 10 more people. It just keeps going. It spreads real quick. So, yeah.
I will say, from my personal experience in working, we do the COVID clinic at McFarland. We have a lot of people that are very hyper aware of when they're in any way, shape, or form in contact with someone. If they even get a little sniffle, a lot of those people are coming in to get tested. There's a lot of people that are calling that have no symptoms. And most of those people, I would say when someone comes into my clinic, I am very, very strict about the amount of contact they can have. And I tell them 10 days from the onset of their symptoms, regardless if their COVID test comes back negative. Most of the time I recommend that they stay home and that everybody in their house, unless there was a direct contact. Now, there's a lot of people that have like mystery contacts that don't necessarily seem solid, but if the other person in their house can stay home, I recommend that. But if they're, an essential worker and they need to go out, then, they need to have their mask and that sort of thing. But I think people are fairly aware of potential contacts, and they're coming in to get tested. And we are testing a lot more freely than we were before. So I think people are taking that seriously. I will say every once in a while I'll test somebody and then I'll see them at the grocery store, which is not great. But for the most part, I think people are taking that fairly seriously when I tell them they can't go anywhere. And I think employers are being good about it as well, because I haven't got a lot of people calling back saying my work's telling me I have to go in. You told me I can't. So that's been good too.
Yeah, I do agree, Dr. Heim. I think employers are very cautious, and they also, if someone calls in saying they're sick, they're like, fine, stay home. The repercussions aren't there like they were before. They've loosened up some.
One thing I wanted to bring up, people put crazy conspiracy theories and, all over Facebook and crap like that. But one theme that I see over and over is this fear that people have and this assumption that there's going to be something posted that says, if you were in Walmart between 10 a.m. and 12 p.m. on this date, you may have been exposed to somebody who was positive that was there. I mean, what is that? That isn't part of the contact tracing, correct?
Right. No, we do not do that. Today, I think in our press release, we put out that if myself or someone from our team calls a patient, that's when they know they've been a direct exposure. We are not going to say, yeah, if you were at Subway between 12 and 1 on March or whatever, May 10th, you may have been exposed. Then everybody's like, oh my gosh, was it me? Was it me? So they will receive a call from us. Any other questions? Or Dr. Heim, do you want it to update any more on COVID?
Honestly, I mean, I think we're swabbing a lot of people. We're still just not seeing that much activity considering what's happening in Crawford County. I think Carroll County's kind of been in its own little bubble. I mean, if you think about it, one of those people had it 6 weeks ago. So, I mean, that's just a handful of people. And I think people are doing a good job. I mean, they're definitely getting restless. I mean, I think people are wanting to get out a little bit more. And to some extent, you know, people do need for their mental health some social interaction. I mean, that's another thing that's very important. But I think people are serious about washing their hands. I'm seeing a lot more people wearing their masks. And I think people in the county are trying to do the right thing. And I mean, I realize there's some people that think it's their God-given right to not wear a mask, and fine, whatever. But I mean, I think there's a lot of people that are taking that serious and are doing the right thing.
Definitely.
Any other questions or anything anyone else wants to ask Sarah, or if the other Sarah has anything to add?
I don't know where I'm at on the agenda, but we're talking about this, so every day I go through all of the counties on the western third of the state of Iowa, and then I look to see the change, and then I send out the change and how many are on the western half or the western third of the state. Basically, I do the Boone, Dallas County to the west. And so there's 170 new cases in our western third out of the 386. And Woodbury used to be the big number jumper, but today they only jumped by 24 and Crawford jumped by 93. So exactly what we were saying, we just had a meeting yesterday and Crawford was at 200 cases and Crawford now hit 300 cases. So Crawford is the second highest county in all of the counties west of the Boone-Dallas County line. Even Potawatomi County only has 138 cases. So I agree with what Michelle said. We definitely have to be aware of what's going on. The article came out about the two additional employees with Pellicorp having it. So then people always assume, oh, then why didn't our number go to 10? Because those two are from Crawford. So with having the Arweva school system, having the Arweva kids go with the Carroll school system, having so many people in Carroll working over in Crawford County, the two additional cases announced at Pella, they live in Crawford County. So we have got the travel back and forth, like Michelle said, the Walmart, everybody seems to stop at that Walmart on the western edge of town. So we need to have a heightened awareness of what is happening right next to us, because several of those people are in Carroll County on a daily basis. So.
And I talked to a county supervisor from Crawford County this morning, and they're looking to relax their openness, I guess you'd say, to the courthouse as well. So I don't know if that's a good thing or a bad thing. It almost gets to the point where it becomes everybody's basically for themselves. I mean, my wife and I are not going to leave the house, unless we absolutely have to. And these are not good times, and for any of us here, they're not just fun decisions to make. I will say that, because whatever you make, it's not going to be right for someone.
Okay. Sarah, do you want to, I think if anybody has anything else on COVID, otherwise we can keep moving forward on the agenda.
Okay. That mass dispensing site location document that I sent you guys, and Becky, you had questioned the Board of Health Council, I believe it says the wording. Heather, if you're still on, if you want to maybe help walk us through this, because I guess I'm really not sure.
What she just said.
So I have like the Board of Health, or the school board president has signed this document that I have. And they also put in points of contact of who I would need to contact at the Carroll Community School District in case we would have to do a mass dispensing site. I mean, that's even like when they come out with a COVID-19 immunization, we're going to have to be able to immunize up to 20,000 people, depending on who wants it. And we would go there. We would set it up at the Carroll School. Heather, I know I was talking with you. If you can help put your input in on this, be great.
Sure. So I think what Sarah had sent to me, it looks like Dr. Evans had signed like I don't know if this was the original one, but at least the one from 2011. And that one, it just says that it's basically going to stay in effect until a written termination or notice. But I think then what happened is that Sarah, rightfully so, wanted to update everything. And so she was trying to make that happen and get the new names and new phone numbers and all of that. So I don't know, legally what the best way to handle it is. Maybe consider this like an addendum to the original one possibly, and just have the board approve it. What were your thoughts, Becky?
Yeah, I just wanted to make sure, because that wording council, to me, that's legal authority. But it's just giving, if Carroll Public is giving their permission that their building will be the dispensary site, I don't, honestly, the more I think about it, know why we would need to have the county attorney look it over. So I just wanted to make sure, before we signed anything, that if there was something we were overlooking legally, but they're going into it willingly, utilizing their building. So I think we should be fine.
So whose name was on the health council from the previous document?
Nobody's was.
Oh.
That was left blank.
So it wasn't right back then either.
Yeah. That didn't help, did it?
Got another one?
And back then, Dr. Evans was the chair in 11. Yeah, he was chair for several years, so. So I think.
So it looks like the one that was just signed, it actually says that it's between Carroll County Public Health / Anthony. Like the heading of it.
At the very beginning?
Mm-hmm.
Well, that, Heather, that was the wording that they used to always use was, sometimes the wording back in the day was St. Anthony Public Health. And that was something that, about 10 years ago, and Dr. Evans was still on the board then, that we really thought that was misleading, and we wanted to make sure that the wording said Carroll County Public Health. So that could be why it's that / Carroll County / St. Anthony.
Well, and the first page does not have any signatures on it, so we could correct it and just get rid of / St. Anthony Home Health Hospice. If that's something we could do.
Does the school has the current copy of this then?
I'm on one of the reasons.
They would have it with the school board president's signature, but they don't have it with my signature on it.
There's a lot more than they're telling. So the two.
I guess, Becky, however you want to handle it would be fine. I think I'd just make sure that all the parties involved have the most current one. Everybody's looked at it, review. It says in there it's going to be reviewed every 3 years. And so it's probably a great time to do it anyway. You don't necessarily have to update it. You just are supposed to review it according to the document.
Have symptoms or whatever, and then she sees them in the room.
Yeah, and that sounds okay. I mean, looking through it, it seemed pretty basic that it's just an agreement that that the school's willing to have their facility utilized. So as long as with everything that's gone on with COVID and knowing that there probably will be mass vaccinations when the vaccine comes out, I would think it probably needs to be more on their end that they're aware and they're all okay. And as long as they're okay with that, that's great. You know, we need to have the site available. So I mean, I have no concerns about signing anything or that anything else in the document needed any other review. But just to make sure that, you know, everybody was on the same page.
About
okay.
guidance.
So should I go ahead, Becky and Heather, take out the St. Anthony Home Health and Hospice so we just have the two entities then?
Other than as far as IDP challenge.
I think that would be a good idea, but you know, would you have to have that reviewed by everybody who has already signed it? I guess that would be my only question.
Dr. Heim said.
Yeah,
that's
and
kind of what I was thinking too.
Fiscal agent and things like that. But this is just there's no money being exchanged. It's giving authority for the staff to do a public health nursing endeavor. So, you know, to me, it just makes sense. It should be Carroll County Public Health, but I don't want to make, you know, too big of a deal out of anything. It's just,
right.
You know, it's just wording, you know, if that's going to slow something down, just leave it as it is, because it's the premise behind it that's important right now to, you know, and we know we've got time. There's not going to be a mass vaccination of COVID anytime soon.
Right.
But, you know, in a year when that does come out, that will be good that we already have that check, you know, that box checked to have that site available.
So what about the signature spot that we have left? What are we going to do about that, about the health council?
I mean, if Dr. Evans signed it in the past, you know, he would have been signing it as the chair. If you want me to sign, that's no problem. You know, I can, we can make an arrangement, or if I can just print it, sign it, scan it, email it back, or if you want the original, just whichever way, it's fine with me.
Okay.
Okay.
All right. Anybody else have anything, or did anyone have any other questions, or Sarah Anderson, if you had any other additional information you wanted to share with the group?
So the biggest thing, I don't know if this group cares or not, but you will see on the news, and you'll see everywhere, or not everywhere, but multiple places in the state that they are doing the rapid testing so that people can have surgeries, or the what do I want to say, where you get your wisdom teeth at, the oral surgeons. So there's several of these places that are wanting the ability to do the rapid testing, so that if you are working in somebody's mouth or opening somebody up, that you want to know that. And for some reason, Carroll County is not able to purchase the rapid test kits from Abbott. So we have put in the request to the state yesterday will be 5 times. What we hear back is, so at the beginning of this, the governor announced that the state of Iowa was allocated 15 Abbott test machines in order to put on mobile carts or mobile trailers, and then she will mobilize those with a strike team to these various counties. So I don't know if, like, she just announced that they created a new testing spot in Beatty County. So I don't know if these 15 test sites are going there, or if these 15 mobile rapid testing machines are being used in long-term care right now. But there's 15 of them. They're controlled by the governor's office. And then the supplies that go with the rapid test kits are also controlled by the governor's office. So they announced that Broadlands, Unity Point, and Mercy were going to start testing everyone starting next week on Monday, so that they can move forward with elective surgeries and so on and so forth with people coming into their clinics, basically giving everybody this 15-minute quick results test. So our hospital is very frustrated. I know the Manning Hospital is very frustrated because when we call in to get supplies for that, or when we call in and say, hey, we have 2 of our own Abbott testing machines in Carroll County, we're not asking for the supplies, we'll pay for the supplies. We just want access to be able to purchase them. It's like saying, okay, you 25 counties, you have permission, but you 74 counties, you don't have permission. So Ed Smith and Trish Roberts reached out to me again yesterday to put in a formal request again. They want to know who the gatekeeper is of the list of special counties that get to purchase the supplies, because they're just wondering why we are unable to purchase the supplies. So usually they like to get back to people within 24 hours, and yeah, it's almost been 48 and we still don't have a response yet again from the state. So it's very frustrating. I've gone up as high as I possibly can. I have Brian Best, who's trying to figure it out. We have Joni Ernst, second person in charge, who's trying to understand. We have another board of supervisors who can reach out to the governor herself. Trish Roberts has, again, a connection with the governor herself. I guess they don't want to be like, hey, you know, why are we on the blacklist instead of on the green list to purchase these supplies? So I'm hoping to get an answer back quickly, because I guess we're not asking for anything free. We're just asking to be on the list, to be allocated some of these rapid test kits that we are constantly hearing about on the news and being now announced by the governor. So high frustration this week on that yet again. And I'm working on my 5th request to that. So just making you aware that we have no idea.
So does that have anything to do with actual test positives and the count that goes with them?
Sarah,
getting back to, getting reported back?
Sarah Schulte, if the rapid test kits would show up positive in that 15-minute window, do they then get shipped over here to get a real test through the state hygienic lab, or what would happen?
No, if those rapid tests come back positive, they're positive. So then, say St. Anthony ran that test, they then have to notify SHL, so the state lab, that there's a positive. So it's through the IDE system. It's an Iowa Disease Surveillance System. And then we get alerted at public health. The nice thing about working with the clinics and the hospitals we have in our county, if there is a Carroll County resident who tests positive, they are going to alert us right away. So we know, but we still kind of wait for the system to catch up.
So, I mean, they're constantly saying that this is not political, and I will argue that all day long. So you've got Des Moines that was just featured on the NBC National News for being one of the top 10 hotbeds in the United States. And she just opened up elective surgeries and dentist office and everything in Des Moines. So with well over 2,000 cases. But the political side of that is that, well, they got to have a way to keep moving forward. As the governor states, we need to keep moving forward. So then you let them have these rapid test kits in order to test every single person coming in the door so that they can move forward with their elective surgeries. But where does that leave the smaller hospitals in rural Iowa that would like to do the exact same thing? And those supplies, I guess, are being hoarded per se, or allocated to specific counties and not shared equally amongst everyone, like the test kits were in the first place.
So Sarah Schulte, is the hospital not doing elective surgeries now?
I believe they are, but they still have to test. They're doing 4 days before the surgery because it has to go out to the lab, like our reference labs, whether it's LabCorp or the state lab, and we have to wait for results. So the only problem with that is between that swab, that collection on 4 days prior to surgery, 2 days prior to surgery, they can get symptoms and test positive, or be asymptomatic and test positive. But we're not testing every day prior to that surgery. So that's where the rapid would come in real handy. That morning, come in a little bit earlier, you get your rapid test done, then you know for sure.
And according to that interview, I watched Channel 13 on Tuesday night. The interviewer had asked, it was either Mercy or Broadlands, and they said that the rapid tests were readily available. And the circle that we get here in Carroll County is that the entity has to purchase the supplies directly from the manufacturer. So here's the number, here's the contact. So we are given the number, we are given the contact. We call in and we said, yes, but you're not on the list. We're not allowed to sell to you because you're not on the list. So the testing is available. We're not asking anyone to give it to us for free. We just want our name on that list. So just thought maybe this group should be aware.
Yeah, that's nuts.
Sarah's in on that email.
Yeah, and a part of me thinks they are working on it. I do think they are, but I don't know if we're a priority for them right now. That's what my fear is.
So this might be a question for Heather. What is going to be the role of the Board of Health in this COVID-19 thing going forward?
Wow, Dean, that's an easy question. Thanks. If I had a crystal ball, I would certainly use that. You know, I think in the near future, it's going to be continuing to support the work of both Sarah's and working on communication and providing community education to all the folks that live in Carroll County. You know, I live in a very small county myself, and I understand your frustrations that come along with that when you feel like you're being left out. So I don't know, unless there were some major decisions that you wanted to make in terms of countywide orders and things like that. But because this is a pandemic, my understanding, my limited understanding from the guidance that we have from Heather Adams, the Assistant Attorney General's office, is that because it is a pandemic, the direction comes from the governor and through IDPH. So a long-winded answer to your question, and I think the answer ultimately is you keep doing what you're doing right now. But I would, really ramp up the messaging that Dr. Heim was talking about and what Sarah was talking about. Keep doing those hygiene things. Wear our masks and social distance. It's all important.
Yeah, to piggyback on that, you can't over communicate the right information, the correct, trusted, the proven information, because so much of the false information is already out there. So, anything, I know staff is so busy. Obviously, Sarah, you're with the contact tracing and everything else. And I know you've been doing a really good job on the Facebook updates. If there's ever an opportunity when anyone can pitch in within the staff or within the either of the hospitals in the county, to try to have some short little videos explaining things. People have limited literacy anyways, but then when you have health literacy, then it goes even farther down, like 2nd grade level is what it needs to be to really get the point across. But that information in a text that's more than 3 sentences, they're not even going to read that. They don't read the whole newspaper article. But they will listen to and watch a video. They won't listen to a podcast that has the correct information, but if it's a video, so if there could even be like step by step, okay, if you do go out and wear a mask, this is how you put it on. These are the things that you want to avoid. Okay, now today we're going to talk about, blah, 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 so just something real, 30, 60-second type tidbits like that, anything through the public health channels that we can get that correct information. Because I think right now that's probably our biggest mission or directive, from the board, to help with the spread of the correct information, because so much of the conspiracy theory and it's against my freedoms, all that stuff is out there, and those voices are loud and they're harsh, and they forward it, and that spreads to a lot of people. We're never going to erase that, but the consistent, just keep going with the messages, say the same thing but word it just slightly different, and just hammer and get that out. But it has to be with graphics, and videos are the best that are really grab the attention. So I guess if anybody has anything else to add, otherwise we'll make a motion for adjournment if nobody has anything else. Any other questions or any other pieces of information anyone wants to share?
Becky, if I may, I just wanted to give a shout out to Sarah with coming into her new position at the timing of all of this. I just feel like she's done an amazing job and serving your county very well, and appreciate the guidance that she's getting from the other Sarah as well, and helping her along, and everybody just working together and trying to communicate. Yeah, the timing could not have been worse for Sarah coming on, but she jumped right in and is doing a great job. So I really appreciate that.
Thank you, Heather.
Yeah, absolutely, Sarah. I mean, there's people that are 20-year public health veterans, and this is a shock to the system to them too. So for you to have less than 20 days, before this all hit. So thank you so much for everything that you're doing. And I hope you're able to get some rest or put COVID aside from time to time. Same with you, Sarah Anderson, as well.
Thank you, Becky.
And I would agree. And thumbs up to Nicole as well, in her position that she just got.
Yeah, she kind of jumped in the same time I did. I think she had about 10 days more than me. So yeah, we're working as a team. down here, and we're working with clinics, hospitals, McFarland. It's new to everybody, and we are just trying our best to get the correct information out in a timely manner also. So thank you, and we have a great team that we're working with too.
All right. So
Very
with
good.
that-
You want a motion?
Sure.
I'll make a motion to adjourn.
I'll second that motion.
Okay. All in favor of adjourning, say aye.
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 All right.
Thank you, everyone.